Good day, class. My name is Matthew Omorogbe, and I will be discussing the major healthcare markers in the development of the United States healthcare delivery system. First and foremost, we're looking at hospital and healthcare delivery system. In the 1820s, almshouses or poorhouses were the precursor of hospitals and were developed to serve primarily poor people. Food and shelters were provided to the poor, and the sick among them were treated. People with contagious diseases such as cholera were quarantined in pest houses operated by local governments. The first hospitals in America were built in areas such as New York City, Philadelphia, and Boston. The hospital system was finally developed around the year 1850s. The hospitals were in deplorable state because of unskilled healthcare providers, who were also the owners at the time. Patients only went to hospital because they had no choice. So this is a marker for hospital and healthcare delivery system. In 1930s to 1940s, this period marks the era of transfer of hospital ownership from the physician who practiced in them to church groups, larger facilities, and government at all levels. The advancements of science and technology during this period led to the increase in the quality of medical training, specialization, and the development of the United States economy. In 1847, AMA was established primarily as a membership organization for physicians to protect the interests of its members. 1904, AMA created the Council of Medical Education to establish standards for medical education. Now let's look at the politics and government policies that marks healthcare delivery in the United States. In 1929, President Coolidge signed the Narcotic Control Act into law. The act helped to provide funding for hospital constructions for drug addicts. In the era of 1970 to 1980, the first Patient Bill of Rights was introduced to protect care consumer representations in hospital care. Then in 1974, a federal law was passed that required all states to have certificates of needs laws to ensure the state approve any capital expenditures associated with hospital or medical facilities constructions and expansion. This act was repealed in 1987, but as of 2014, about 35 states in the U.S. still operate some forms of COM mechanism. In 2010, Affordable Care Act of 1965 was passed, and its major goal was to improve the public health of the nation of America. In 2011, the Affordable Care Act created the Centers for Medicare and Medicaid Services, Innovation Center for the purpose of testing innovative payment and service delivery models to reduce program expenditure, and at the same time preserving and enhancing the quality of care for individuals who receive Medicare, Medicaid, and Children's Health Insurance Program benefits. Health insurance system as a marker of healthcare delivery in the United States. 1800 to 1900, health insurance was purchased by individuals in the same way one would purchase car insurance. In the year 1847, the Massachusetts Insurance Company of Boston was the first insurer that issued sickness insurance, followed by French Mutual Aid Society in San Francisco, California, and then others followed. In 1930, AMAP opposed the move for National Health Insurance Program. The reasons was due to depression and U.S. participation in World War II, and this makes the fund required for the program not to be available. In 1940s to 1950s, the World Labor Board froze wages, forcing employers to offer health insurance in order to attract potential employees. In 1947, the Blue Cross Commission was established to create a national doctors network. And by 1950, about 57% of the population had hospital insurance. 1970s to 1980s marks the era President Nixon signed the HMO Act. This was the predecessor of managed care. In 1982, Medicare proposed paying for hospice or end-of-life care. 1985, the Consolidated Omnibus Budget Reconciliation Act, which is known as COBRA, required employers to offer partially subsidized healthcare coverage to terminated employees. 1990 to 2000, President Clinton's Health Security Act proposed a universal healthcare coverage plan, which was never passed. Then in 1993, the Family Medicare Leave Act, which is FMLA, was enacted. This allowed employees up to about 12 weeks of unpaid leave due to family illness. Then we also have in 1996 the Health Insurance Portability and Accountability Act, which is HIPAA, was enacted. This makes it easier to get health insurance when changing job. It also increased the confidentiality of patients' information. 1997, the Balanced Budget Act was enacted to control the growth of Medicare spending. The Act also established the state's Children's Health Insurance Program. In the year 2000, the State Children's Health Insurance Program, which is now known as Children's Health Insurance Program, was implemented. Now, on all of these, what we consider as the most important marker of the U.S. healthcare delivery system is the Affordable Care Act. The ACA has been regarded as the most important healthcare legislation enacted in the United States since President Johnson signed the Medicare and Medicaid program into law in the year 1965. In the year 2010, the Affordable Care Act of 1965 was passed, and its major goal was to improve the level of public health in U.S. In 2011, the ACA created the Center for Medicaid and Medicare Services Innovation Center for the purpose of testing innovation payments and service delivery model to reduce program expenditures, and at the same time preserving and enhancing the quality of care for individuals who receive Medicare, Medicaid, and Children's Health Insurance Program benefits. According to the United States National Library of Medicine and National Institute of Health, the Affordable Care Act has made significant progress towards solving long-standing challenges facing the U.S. healthcare system. Problems that relate to access, affordability, and quality of care have become things of the past. Information from the U.S. National Library of Medicine states that since the Affordable Care Act became law, the uninsured rate has declined by 43%, from 16% in the year 2010 to 9.1% in 2015. This is primarily because of the law's reforms. Research has also documented accompanying improvement in access to care. For example, an estimated reduction in the share of non-elderly adults unable to afford care of about 5.5% points. Financial security is also one of the benefits of ACA. For instance, an estimated reduction in debts sent to collection of about $600 to $1,000 per person gaining Medicare, Medicaid coverage. And lastly, health. For example, an estimated reduction in the share of non-elderly adults reporting for fair or poor health of 3.4% percentage points. Now, the law has begun the process of transforming healthcare payments systems, with an estimated 30% of traditional Medicare payments now flowing through alternative payment models. For instance, like bundle payments, which help to reduce healthcare spending and still sustain improvement in healthcare quality. I would like to conclude my presentation by stating this biblical perspective from Proverbs 3, verse 7 to 8. Do not be wise in your own eyes. Fear the Lord and shun evil. This will bring health to your body and nourishment to your bones. Thank you, and God bless you. Bye.